How did it feel on the day when you realized you passed your exam, Arsalan?
Oh, I was very relieved. I was in tears because I didn't believe that I've done it. I think it was an absolute joy. I called my family and everyone was really happy. You were always coming back to me. You were telling me, please actually listen, please actually listen. I told you this in that part of consultation. You missed that. You have to actually listen. Style was quite different. It was mostly hospital-based doctor like a consultation. It wasn't like more focused on like as a GP consultation from the style from this course about taking consultation, which I'm still doing it, that style of consultation, but because that encourages me to finish the consultation in time and also encourages the building up rapport with the patient and also helps them to empathize with them when they are feeling sad or when they tell me something sad, things like that, simple things like that, which I felt were really handy. Like you said, like if someone tells you a sad thing or if someone tells you like thing which makes them sad or depressed, you just can't sit on it.
Are you feeling nervous about SCA? Maybe you don't know where you stand or you don't know how to prepare. What if you could pass your exam in your first attempt? Hi, my name is Dr. Erwin Kwun. I've had hundreds of GP trainees pass. In this video, we're going to dissect the preparation of an IMG who passed SCA in his first attempt. You're going to learn what strategies he used and what exactly he did to pass in his first attempt. Let's dive right into it. Hi, Arsalan. Welcome on the channel. How are you doing?
Hi, Dr. Kwon. Thank you so much for having me tonight, and it was a pleasure over here to join you.
For people who might not know you, tell us a little bit of background about yourself, Arsalan.
So, as you have introduced me, my name is Arsalan Shahid, and I'm a GPST3 working in Derry, Northern Ireland at the moment. So, uh, as like with anyone, like I feel like as a CA exam is one of the challenges a GP trainee can encounter, and this was always in my mind once I started my ST3. Even before ST3 was like in the later half of ST2, I was always thinking about it. How will I sit on with SCA exam? How will I do about it? Like, and I was quite nervous and then I was going through the YouTube and I was going through the Google and I was looking for it, like how can I seek help? And then I was just scrolling through the Instagram and I landed up to one of your posts on SCA and I listened to a few of your videos on the YouTube. You pinned some link on the YouTube link on the Instagram, so I opened that link, and then from there on the journey started. So I got in touch with you, and I'm quite relieved and delighted that I got in touch with you in time, and things worked out.
Yes, I remember you got in touch quite early in your
Yeah.
exam preparation because at the moment you're in your ST3 and I think was it around the finishing of ST2?
Yes, so I got in touch with you. I think as far as I remember, I think it was later half of June,
Mhm.
and I was planning to sit either in October or November. I wasn't sure back then, but I was like the thing was that which would made me in touch with you quite early was because I had a few history of like an exam failures in the past as well. So especially the clinical exam. So I was quite nervous to sit in this exam because this exam is not as like as a practical clinical, but it is quite challenging in a different way, like in communication way. So I was thinking probably I would need some sort of a tutorship, for this one, and I also need like a proper guidance from someone who can give me and tell me like how should I prepare about it, how should I do. So I think getting your mentorship was quite handy, and I'm really really pleased and thankful to you.
Yeah, I'm so pleased as well that you managed to pass your exam. When people have fear of failure, it's usually another fear underneath that fear of failure. What do you think was a fear underneath that for you?
So see, so in the past, like I feel now once I've cleared this exam, probably once reflecting back on my past experiences of the exams, probably uh, under preparation of exam was probably I feel a lot of times people feel that they're ready for the exam, but I feel that getting a proper preparation and mentorship is really essential to sit in any sort of an exam, and especially in the SCA exam, I feel that. Me as an IMG who like in English is not my first language. So getting polishing my like skills, like communication skills, and getting better at my interpersonal skills, empathy, and getting more out of you about data gathering. I think it was quite handy. Things which I wouldn't have grasped, if I haven't done the course, So it was really handy to do the course.
Give us an example of a moment when you felt like, okay, now I understand it. Like, did you have an aha moment, Arsalan?
So I think it was a very first meeting with you, So I think it was an hour long. I still remember that. We sat down. I really liked the way of you, how you started that. You asked me about my background, my clinical background, and you asked me like quite a straightforward question, like, why would you like to take this course? So a lot of people won't ask this question who are offering the course, but you were quite straightforward, and you wanted to know about me as personally as well. What was the reason I am sitting in the course with you, and what I want out of it, like, so that's really I would say helpful in getting like building from your end, get rapport with me, like, that what I want from it and what you have to do with me to help me in clearing the exam, so it was really handy from the first go. Yeah.
That's great. Yeah. So you had that personal touch and you found that useful. So tell us about your exam preparation. So how did you structure your preparation going in?
So in the start, so I started, so we got in touch in June. I think we started formally the course in July, I remember. So initially, I think I did first few sessions with you, and then you made a core group of us. Like we were three, like that, and then there was another person who added on. Then there were four of us. So often we would meet like 3 times a week, um, and we would do like a few cases, 3 times a week, and then at the very end of the exam, we were meeting like 4 or 5 times a week as well. And on top of that, what you advised me, and which I felt, which was a really great advice, was to make videos in the surgery. So I sat down with my education supervisor as well, just made like a plan with them, like, at the very start of my ST3, that I had to do an SCA quite early on because my ST3 started in August and I sat in November, so it was only like 2 or 3 months there. So my each tutorial was like my supervisor was reviewing my videos. I used to see those videos play, rewind back as well, and just to think, listen to them, watch them, like how was I performing and how should I do things better. So I think that things like that, advice about making videos was quite handy as well.
Great. Yeah. So you were putting in quite a lot of work and recording and practicing. Tell us about the changes you've seen in the relating to others, which is a domain many IMGs struggle with.
So when I started my SC2 in February last year, and my consultation style was quite different. It was mostly hospital-based doctor like a consultation. It wasn't like more focused on like as a GP consultation. So which I learned from the style from this course about taking consultation, which I'm still doing it as currently as of now. Even I finished my exam, but I really find it helpful, that style of consultation, because that encourages me to finish the consultation in time, and also encourages the building up rapport with the patient, and also helps them to empathize with them when they are feeling sad, or when they tell me something sad, things like that, simple things like that, which I felt were really handy. Like you said, like if someone tells you a sad thing, or if someone tells you like a thing which makes them sad or depressed, you just can't sit on it. You just have to address it there and then. You have to say a sentence, 1 or 2 sentences, like they're expecting a 1 or 2 sentences of empathy out of you. Like if you just go on blah blah blah, okay, you just say the question again and again and again, so it doesn't look nice. So things like these. And then if someone tells you anything exciting as well, which I felt there was a scenario in the exam as well, that one of my patients was quite exciting about telling me about upcoming competition, I remember. And so I just really asked the question like, how do you feel about the competition? So things like that, you have to build rapport with your patient. So I feel that relating to others, so out of my 12 stations, I passed my 10 relating to others, So it was quite, I think the course really helped me to build up the relating to others part. And also that addressing the ice, the other thing which I wanted to address over here is that you told me that whenever someone mentions ice, you have to ask ice quite early. And then you told me that you have to summarize ice before you're going on to the management. So that was really helpful as well in the exam. So simpler things like that make a bigger picture.
Yeah, small changes
Yeah,
made big
yeah,
impact. And
yeah.
the reason why I suggested that you do the eyes early is so that you can understand what's going on in the patient's mind and also set the agenda for the rest of the consultation. How would you like to have a playbook that over 200 GP trainees have used to pass SCA exam? If you'd like to download the free copy of the SCA blueprint, click the link down in the description and you'll get a free copy, and I'll also give you daily teaching for the next 7 days. Click the link and you'll get it for free. When you summarize it at the midpoint, it also helps you to signpost yourself, what am I going to readdress in the management? So tell us, what did you find the most challenging thing about the SCA, Arsalan?
So the most challenging part is that I think I probably have some attention deficit problem. I don't listen to the people quite. So the thing which I learned to change my habit from you and from taking the course essentially was active listening. You were always coming back to me. You were telling me, please actively listen, please actively listen. I told you this in that part of the consultation. You missed that. You have to actively listen. So I think the most important thing was changing the habit of not listening to becoming an active listener. So that was quite useful.
Yeah, I think that's a good point that you've raised. What I've noticed among doctors who actually work in hospital, it can be quite difficult to get into that GP consultation style where there's cues that you have to recognize and pick it up. And if you miss a cue, then it can completely change the way you manage a case. So tell us about your experience going into the exam then. Did you feel like you were confident or do you still have some self-doubt?
So I still remember. I think you still have my email. Like, even the night before, I had a bit of a self-doubt. But I think that's just a human nature. Like, you always self-doubt about yourself. But I think that's good enough as well in a way. Like, if you're too much overconfident, that's not good as well for you. You're just sitting an exam that you will rock the exam. That's not the case because this exam is quite different and. It's not like you will rock the case. Probably some people would, like probably they might not need any mentorship, but like a lot of people, like especially I would say IMGs, and who are like really struggling with SCA, like in their previous attempts as well, or anyone who's sitting in the first attempt as well. This exam is quite different from our previous exam experiences. Like, I would say because I never had any experience of doing a video exam before, so because my version of medical exams was always like there will be someone just standing beside me and he will be looking at me listening to the heart and listening to the chest and doing blood pressure and all those things so it's quite different because there's no one looking at you but there's someone like a remote thing they're recording it but there's no one looking at it, it's just you and the actor who's just in front of you. So that's why I think the attitude, the second thing after active listening, which you made sure in your whole teaching was that the attitude needs to change. And that's really essential, you know, because if you don't change the attitude, uh, you will not gain anything at all. So if you want to change attitude, that will change your um, building up rapport with your patients. If you change your attitude, it will enhance your skills of data gathering. If you change your attitude, it will enhance your skills of telling management. So it's all goes back to the thing that you have to be ready to change yourself.
Yeah. And this is where, when you are able to do that over time, you embed that good practice. And when you do it in the exam, it feels more natural to you. So, one of the things I remember was you mentioned when you were role playing, you felt like when you were role playing with your study group, it was quite different compared to when you were role playing with your trainer, and you felt like sometimes the type of data gathering is different where you could be thrown off. Tell us a little bit, how did you feel the difference?
So, say, like, if you're role playing with someone of your peers, or like, it can be sometimes quite casual as well, and they can sometimes give you an honest feedback, but sometimes they can be a bit lenient towards you. But like, if you're a role player with yourself or with your mentor or anyone, like, you would need someone a solid critique about your consultation. I would say that, because someone is just giving feedback just for the sake of feedback, it won't help you at all, because you would need someone who can give you a positive and a solid critique feedback, that this is the thing you did really well, and this is the thing you need to improve. And because I still remember I did like my last session with you, I think it was like 5 or 7 days before the exam, and you were still saying that, no, if you do this, you will not pass this station. Like, you'll probably fail this station, So you were not giving me any green signals at all. So you were always pushing me, like, I have to do better, better. So I think that was the key that really helped me.
I see. Yeah. So having that feedback where you can interpret it and also use it is really important. And the quality of the feedback is key determinant on the quality of the consultation when you improve it. So tell us, how did it feel on the day when you realized you passed your exam, Arsalan?
Oh, I was very relieved. I was in tears, because I didn't believe that I've done it. I think it was an absolute joy. I called my family, and everyone was really happy. And I couldn't believe it that I have done it. And it was a big, I would say, weight off my shoulders, because I have a bit of an ST3 left, and I'm just a bit more relaxed now. I'm just doing my other things around the training, So, and I remember, I think I texted you there as well. And I was very, very relieved, very happy, and I don't have any words. I don't know how to express the emotions, but it was a very joyful moment. Yeah.
How has life been since you passed your exam then?
It's great. I'm just more focused on doing more and more consultations as a GP, and just doing the time of my GP training, and getting through to my portfolio and all other things, focusing on other things. And I'm just very delighted that exam is on my back. I don't have to worry about it anymore. But yeah, it sometimes doesn't feel, it's like feeling surreal, that I have just passed it, and it isn't there, So, but whenever I open my portfolio to like fill in any like my clinical case or any reflection, and I see that green tick in front of that SCA, it's a big relief, So.
That's so amazing. I'm so happy that you've managed to jump that hurdle. For somebody who's listening to us right now, a bit hesitant about investing in coaching, what would you tell that person?
Well, because a lot of my peers, after passing the exam, have asked me, and as well, I'll tell the same to you. So, I feel that a lot of people won't seek mentorship for the first time. A lot of people will seek mentorship if they have failed the exam one or twice. Like, I see that thing, that if even if you are sitting first time, second or third time, you feel that you're lagging in something, or you feel that uh, you need help. I would say that either way, the mentorship is really, really key to get through to the exam, even if it's your first, second, or third attempt, And even like for myself, I was sitting for the first time, a lot of people were telling me, oh no, you're just sitting for the first time, you'll be grand, you'll do it. But like I had the thing, like as I told you, like my history of not clearing the clinical exams, I had that my thing that I think probably I would still need some mentorship, So any person, any trainee who is sitting the exam, I will advise them that mentorship is really essential, because in the mentorship, it teaches you how to change the attitude. It teaches you how to be an active listener. And it also teaches you to how to do an active consultation within 12 minutes, because time is the key. Time over here, when we are practicing, I am practicing with you, or I'm practicing with my other peers, 12 minutes still feels that it's long enough, but like time 12 minutes in exam, it really passes very quickly, like, which I felt was a big difference. As soon as you finish it, one consultation, there's a second session, there's a third one, there's a fourth one, there's a fifth one, so it all like bang, bang, bang. Even you're practicing, you don't practice like that. If you're practicing with someone, you'll practice one case, and you will say, okay, no, I will uh I will do it like in a minute. You will get a feedback, like a casual feedback, and you'll say, okay, I'll read about the second one, and then you do. But like in exam, it's like bang, bang, bang. So it's quite different.
Absolutely, yeah. So that's why it's so important to train at a very high standard. And then when you sit your exam, you know you're fully prepared and you manage to clear it. And in your case, it was quite straightforward. You pass it first attempt. And it's also credit to the work that you put in, being early in your preparation and going smart, where you knew that self awareness, where you knew that you had some issues in the past, so you didn't want to have the same problem. So you broke that cycle, which is quite useful for somebody who might have the same pattern going, failing an exam and trying the same thing. You won't get the result that you want if you're doing the same thing. You have to change it. So, what can we say to somebody who actually is thinking about how do I prepare in my own clinic as well? Because I know you mentioned you also were doing some recording, and what were the things that was useful in your clinic that you use in your SCA?
So, in my clinical setting, I was doing audio recordings, I was doing video recordings, I was listening them back, and then I was playing them, and then I was listening them back again. So I was just trying to listen back and forth, just to try to listen to myself, like if I'm saying any word or sentence properly, if I'm saying or if I'm showing empathy properly, or how can I improve it. So I was doing the same with my trainer as well. So we used to take two videos and we will just listen back and forth and just try to get an honest feedback from the trainer. My most of the teachings leading up to the exam were just SCA based, So I just requested my trainer, like if we are just focus on getting more and more videos and getting more and more feedback. So it was a good support from the trainer as well in that regard. And the other thing was that um, I was just reading through a lot of nice EKS guidelines as well, so it was quite handy. Like, if you see some high yield case, like, chronic diseases, or if you see any pediatric cases, like, so just go through either to way whenever you see something new, or if you feel that this particular scenario could be a high yield. I would say just there and then open the nice EKS after the patient leaves you and read about it, like, and this will just enhance your knowledge as well.
That's great. So you were completing the learning cycle straight away. That
Yeah,
was quite good.
yeah.
Anything else that we haven't touched you'd like to mention before we wrap up, Arsalan?
I would just wish everyone in the future who is doing or sitting in the SCA exam all the best to their preparation. And I'll still encourage people to get the mentorship if they're in doubt, and because if you uh, keep yourself in doubt, it won't help you. You just have to seek help. If you're in doubt, seek help, and that's the most important key.
Great. Thank you very much for sharing your experience today. If you want to join the program, the one-to-one coaching, I'll leave a link down. You can just click on it and then we can have a chat, see whether I can help you. And if I can help you, then we can get you started. But if I can't help you, I'll let you know as well, because I only take people I know I can help. So it's so good to see you on the other side. What can we wish you now that you finish your exam and you're going to CCT soon?
What can I wish you? I think it's a great question, but I will say I'm just looking forward to become a fully full-time GP, like, and see how that goes. I haven't decided where I will be working and how the work will be. I'm just thinking about it and just trying to get my CV sorted as well. And I will think I'll probably send out my CVs to in the future, coming few months and weeks to different people and see how that goes. But like, I'm really looking forward to be as GP. Yeah.
Great. I'm so glad that you're looking forward to finishing and becoming a GP. And if you need any help from me with your career, please feel free to let me know. I'm happy to help. Thank you so much, Arsalan, and I wish you much success in your future.
Thank you. My pleasure. Thank you so much.
Have you found the video useful? If you found it useful, you might want to watch the success story of Dr. Sridharan Peters. Click here to watch it. Take care, everybody. Bye-bye.